Hi, I'm Steve White. Let's talk about another side effect that a lot of people are used to. That's hair loss. I say used to. I'm not sure anybody gets used to having to lose their hair. So this is something that seems to be very trying, especially on women, but on men too, in the fact that they get scared the fact they're going to lose their hair. Now, understand a couple things. First of all, you probably will grow back. The hair will probably grow back. Okay, so that's a good thing. Sometimes it grows back a little differently. Sometimes it'll grow back curly or it'll grow back a different shade. So it's kind of interesting and maybe a surprise. But the fact is why do you lose it? Well, we talked about it in other videos, but remember, hair is full of fast-growing cells, and that's what the cancer is out there to get after, is the cancer that grows very fast. So this is the reason why you also lose hair, is it's attracted to the fast-growing cells. It's maybe the easiest way for me to explain it. So what do we do with that? How can we deal with it? Well, first of all, I want to deal with what I think is the most important, is that your head gets tender. Your skin gets tender sometimes with chemotherapy. So it's not that it just all of a sudden falls out, and sometimes it will fall out over just a couple days. A lot of people find that it falls out in the second week, third week, but sometimes it falls out real fast, sometimes it comes out slow. But while this is happening, lots of times your skin is very tender, and we need to be very, very careful. And I've had patients before that they wanted to shave their head with a shaver. That's probably not the best way to do it. If you are going to shave your head, you would want to shave it with an electric razor. But here's something to think about. Talk to your doctor, talk to your nurse. They usually can tell you by the type of chemotherapy you're having whether you're going to lose your hair. And if you are, and you're wanting to get into buying a wig or having a wig, it's best to do that while you still have hair. So you can go to the place where you're getting your wig, even go to your own hairstylist, and then they can try to compare and try to get something that you're really comfortable with. And sometimes that's easier to do when they see how you look now, okay? Now, probably the most important part of the hair loss is what it does to you psychologically. And I really want you to try to focus on the fact that this is a positive event. Boy, Steve, you really push too hard for that? Yeah, I guess I do sometimes, because this is a troubling event, and this is going to be a shocking event. So team, you got to get around the person that's losing their hair. You got to be a part of it, be reassuring, and be there for them, and know that for most people, not always, but most people, it's a temporary situation, okay? So make fun of it. There's people, not fun of the person, but make fun of the situation. There's people that go out and they love wigs. You can get incredible wigs nowadays. You may wear scarves, you may wear different things, whatever you're comfortable with, but acknowledge, teammates, that this is going to happen. Acknowledge that this is a troubling time for the person it's happened to. And it's not just that they're going bald, it's just a weird feeling when all of a sudden you're grabbing clumps of your hair and it's falling out, or that it comes onto you so hard and so fast. And it also can be not really painful as much as just tender, and maybe some people will experience some pain. Most importantly, again, talk to your doctor and your nurse, talk to the people in your doctor's office. They usually can put you with people that have companies, that there's companies that will actually give you discounts, or even some places where you get free wigs, free supplies to help you through this time period. Some insurance companies will even cover it. But let's just recognize that this is a trying, emotional time. Surround yourself with your team, realize it's temporary, realize this is happening because, again, the chemo is doing its job. It's getting in there doing what it has to do. And keep your mind focused on that this is a game that you're going through, but it's a game that you're in control of. And you got to know, talking to your doctor, that it's going to happen. Get yourself ready, get yourself prepared, and then take it on like a champion that you are.